Second page here it says crash cart. So they in here it'll tell you what's supposed to be in the crash cart. Typically, when one of your patient becomes incapacitated and stops breathing, you want to have this crash cart next to you. Okay, this crash cart comes with a non-rebreather. It comes with an ambu bag, suction machine. It comes with a some of the oxygen equipment. Also, it comes with what is it? The CPR board in two different sizes, one for large and then one for a smaller patient. It's got extra cords in here, a breathing machine, and then also it's got this neck collar and stuff like that that's on there, okay? So on the top of your list, it's gonna ask you how to put these oxygen on, okay? How do you properly use this oxygen? In a situation where you have a patient who is, stop breathing and you do the increased oxygen by a whole lot, right? This is, the air that you breathe is 21%, right? If you need to give your patient a whole lot more than 21% because they're not breathing, every one number goes up to 8, right? You add an extra 4%, right? So for example, 21% is the air that you breathe. If you go up 1, you add another 4%. So that's 25% oxygen, right? If you need 100%, this cart fortunately has a non-rebreather. I'm gonna show you how to use a non-rebreather. You try to get to as close to 100% as you can. This probably not gonna get you 100%, but it's better than nasal cannula when you have a patient that's not breathing. You need to add more oxygen. Okay. First, let's demonstrate because there's a lot of us in here. Just gonna demonstrate it instead of having everybody do it one by one because we'll be here all night. One of the things you want to remember is you want to take this little red cap out. Okay? Took me a long time to figure out that. I thought this was part of it. So the oxygen guy said, no, go ahead and take that out. So inside of this little thing here, there's already a plastic cap. This new one right here is actually a nice plastic cap, so you don't really need this. The older ones are going to get all mashed in, which means you probably need to change this. Okay? So it's got 2 prongs at the bottom and then one at the top, a little circle one here. Okay? Same thing here. It's got 2 prongs at the bottom and one at the top, right? What a lot of nurses sometimes go through is the air leaks out. And it's because this is bad right here. Okay? Sometimes the whole oxygen itself is bad, and you might have to change the whole thing. Just get a new one, right? We really try to have nurses deal with this instead of CNAs, because it's a form of medication, right? The CNAs can't be really turning this on and off. So you want this nice and tight on there, and then you want to get the oxygen here, right here. Okay. Oh, you don't even need this. This is the newer one. So you don't really need this. Some of them you do need this. All right? It's like a little key. So turn that on, and then you can get how many liters you want in here. Up to 8 liters. Okay. Now, if you need more oxygen, I'm not gonna waste this. Let's just say you need more oxygen. You want to get up to like 16 of this right here, right? You have a splitter on here. You can get a lot of oxygen, right? On this crash cart, somewhere in here.
I think you left it out, no?
Right here. What the heck is that? Right here, right? So if you have 2 oxygen, you have 2 of these oxygen. You can have both of them on. And then you can add this on like this, okay? And then if you have a splitter, you can double your oxygen. And the same thing with the concentrator, guys. That's why I have 2 concentrators over there, right? You put this in a Y form, and then you connect this with the other another tank. And then this connects into like a nasal cannula or something that you wear in your face, right? So that you get a lot more oxygen, right? You get double the oxygen now. Okay, that's being pushed in. Okay, so with the with the non-rebreather, okay, this means that you're breathing pure oxygen, you're blowing everything out, and you're breathing 100% oxygen. In order for this to work, if you have a patient that's not breathing anymore, you know, you need a nice flow oxygen in there. You can get this ready by turning on your oxygen, right? And then make sure it's pumped up before you actually put it on the resident's face, right? Or you can connect this actual oxygen in an ambu bag, right? If you need to do CPR, and they need oxygen. The non-rebreather works by then putting this together like that. So this will get filled up. And you want this nice and full of 100% oxygen, okay? The non-rebreather, when you breathe in, you'll breathe in 100% oxygen, you'll blow everything else out right here, okay? But just make sure before you use it that this is pumped up all the way up, okay? And it might take a couple minutes. Meanwhile, maybe you can start doing your CPR, okay? Any questions on the non-rebreather, right? The nasal cannula is going to give you very little oxygen, okay? So this right here will give you a significant amount of oxygen. When you're a patient that's desatting 76%, 60%, you need to get a nice flow. A lot of times when a patient is anxious, if you can't get the oxygen up to go up, the non-rebreather really works, okay? And it helps to calm their nerves too, okay? So that's how you kind of manage it. The same thing with the concentrator, you guys. You can do a splitter, and if you have a patient that's going to stay with us for a while, is not going and is waiting for the paramedics to come in, and they don't have any tank, you can use the concentrator to use the splitter. You can double the amount of oxygen you can have. Okay. Let's see what else is on the next. Does anybody have any question on how to put the O2 concentrator together with the liquid with water on it? Huh? Humidifier. Do you guys know how to do this already? So I'm not going to go over that. Anytime you have 2 liters or more, you should probably add the humidifier in there. Keeps the nasal passageway nice and moist. Okay. On here, guys, what's the ratio with the CPR?
30 to 2.
30 to 2. Okay?
Yeah.
And here at Seacrest, let's just say we have a scenario here. Okay? Rosanna is passing meds, and she comes across room 32B is no longer breathing, and there's no more pulse on there. All right? What's the first thing that we should do? Okay.
You find out if it's
The full code?
if he's a full code.
Yeah. So this patient is actually full code, right?
Right.
The patient is full code. So what's your next step?
You have to call for help first before you start anything.
Okay, that's good. You need as much help as you can, right? Okay, so now not only Ate Rosanna is there, but now Helen's there, and she's got a whole bunch of other CNAs with her. What's the next step for this full code patient that's no longer breathing? Maybe the last time we saw this patient was 15, 20 minutes ago.
Start compression.
Start compression? Okay, where? The patient's in bed. How do you prepare the patient for compression?
The board.
Put the board? Okay, so now we're deciding to put the board because we don't want to bring him outside the bed, right? We don't want to bring him down, so we're going to do this in bed. What is the correct positioning with your compression? Does anybody want to demonstrate compression?
Where's the mannequin?
Just like on the table here, right here. How should your arm look like, and how deep do you gotta go? 2 inches.
Shoulders over your wrist.
Your whole shoulder. What should happen in your elbow?
Elbow
It
straight.
should be locked.
Locked and
It's locked.
at least 2 inches. At
2.5 inches is what I always say.
Yeah, at least.
Okay. And I think we've had this incident a couple times here at Seacrest, and it seems it was very traumatic, right? Some of us may or may have not seen CPR before, but just know that if you have somebody who's 85 years old, when you go 2.5 inches or lower, you're gonna start getting this crunching movement. Okay, don't, you know, it's scary, but this patient is no longer breathing. So yes, you're gonna crack some ribs, and so you gotta continue to do the compression. And what else will you be doing for this patient? Maybe I think Rosanna is doing the compression, right? 2.5 inches with elbows locked in. You can do 30.
Helen can grab the cross part.
Grab the crash cart, and what are we grabbing?
The
AMBU
bag.
AMBU bag. Okay, and what is Helen doing? So this one, this tube attached to an oxygen if you need to, right?
So after 30 compressions, she administers 2 breaths.
2. And when do we stop, guys?
You do not stop.
We do not
until
stop
paramedic
until-
blood.
Until,
Yeah.
paramedic
We don't stop
leaves.
until paramedics come in.
Yes.
They're gonna do, once they come in, they're gonna continue to do the compression, okay? What about you, patients that are on hospice, we tend to think, oh, they're gonna be DNR. We've had patients before that are full code that are on hospice. Here's the most complicated part. A lot of times, we know this.
I thought that wasn't allowed, John. They had to be DNR to be on hospice.
No,
There's options
we've
for
had
family.
options.
We did have one person that was a full code and on hospice.
So here it is, guys.
And we had to do
No
compressions.
matter what the choices are of family members, even sometimes the record is messed up. The book will sometimes says full code, and the computer will say DNR. So in that situation, you probably have to call and just double check to see which one is the most accurate, right? Which one is the most updated. Okay, because we've had that situation where the patient came back from the hospital, they were DNR before, and now they're full code. Too many times we've seen that. So just don't jump the gun because hey, they were DNR last month, they're DNR today.
So when in doubt, just do chest compare? What do you?
Most recent.
I would do the most recent. I will do the most recent
John, you don't
in
have to
terms of date. In terms of date. What are you saying out there?
What
do you
I'm
recommend?
saying is, when in doubt, what do you do?
Then you check the most recent dated, right? DNR, right? Because I mean that if the DNR was last month and now you full code this month, then you follow that the form, right? It's the most recent one.
No, we're just talking about,
Oh, okay.
you said sometimes people change when they come back.
Yeah, so it's not an easy situation to be in, because not only you're trying to rush and calling doing everything you can, and then you have these records that indicates, 2 different things. So make a good judgment, call the doctor, call the family. But at that point, you're just trying to move as fast as you can.
So while you're
Okay.
calling to confirm, are you doing compressions?
No.
If you, yeah, you have to kind of
You can't
confirm.
stop, right?
You have to confirm. Well, I would confirm first, and then I would check the most recent form, whatever it is, whether it's a computer or it's a paper form. That's the most recent, because it's gonna be scanned too. So there's some places you can check. So, but the most important thing too with DNR is that you're explaining to family members what's gonna happen with this patient when you're doing CPR. Okay. It's really our job as nurses to really explain to the family that, your loved one is 80 years old, this is what's gonna happen to them when we do compression. We've had 2, I think, in the last time I've been here, the last, 12 months, 6 months, and they've all expired, they never made it. So the chances of even being alive after compression is very little, okay? And it's traumatic to the patient, right? And so explain that to the family member, that it's not a movie where you do compression and then the patient is alive after you do this compression to the hospital. You do compression, this is what's gonna happen, you're gonna go to the hospital, and there's very little chance of them living, okay? And it's trauma to this patient who's already, on their way out, okay? All right, any questions on the crash cart? The suction machine, yes,
No AED, right?
No, yeah, I was
we don't
gonna
have an
ask
AED
about
here.
the
Yeah, we don't have an
defibrillator.
AED.
No? Okay.
We tried implementing that here, it just, we've never had it here, and we don't plan to have it here anytime soon. Maybe one day our policy might change, at the moment we just don't have it.
That's why you call 911.
There you go. All right, the last thing I'm gonna go over, guys, is putting this together. So who in here, what nurses in here has a hard time of trying to make this work? This is a suction machine. You plug it in. This little cap right here goes right here. There's arrows in here too, guys. If you put the wrong lead on here, the suction is not gonna work. So if you have a patient that you're trying to do CPR and you got froth and everything else coming out of the mouth, and you can't make this work, it might be a little difficult for you. Okay? So you put this on the lid, and it's gotta be nicely like closed. Otherwise, you get a lot of air coming out, and the suction is not gonna work. Okay? And so this arrow right here is pointing here. It says to patient. So that means that this long piece right here with the suctioning goes here, and then it will go to the patient's mouth when you're doing suction. Okay, so that connects to here. You're doing oral suction. All right. There's another piece to this, which is tracheal suctioning, and that's really effective when you have a patient that's still, breathing but gurgling. You try to remove some of that fluid that's kind of like a little deeper down. Okay, so those tracheal suctioning is available. I believe you have it, some in here, but it's a lot thinner and go down a little deeper. Okay, so this little piece right here, it says here to vacuum. That goes in here, and then it goes to the vacuum right here. Okay, and then you plug it in, and that's how you use your suctioning. It really helps when you're doing compression and you have a lot of fluid. You're dealing with a lot of fluids. You have somebody doing compression, you have somebody doing the ambu, and you have somebody doing suctioning. So it's good to have a lot of help in that situation. It gets messy, trust me. Okay, you have a lot of stuff coming out, leaking out, squirting out, and it becomes very traumatic.
When you alert everybody, it's a code blue, correct?
We don't do code blue, basically.
Code blue.
We don't do any kind of codes. In fact, we just try to gather as much people as we can. Yeah, we don't do any kind of code here. We've never done it. Maybe
No,
I don't know if
we
should or not.
assign and then you call 911, you get the.
We just work as a team, basically. You get as much people as you can. Somebody does compressions, somebody does ambu, somebody does suctioning, somebody calls a family member, calls a doctor,
So nothing will ever be said overhead?
No.
Like code blue?
No. I think I've had somebody call me, John, somebody's over here not breathing.
Just shield
And that was
them
it. And then we run over there and we help each other out.
Okay, all right.
Okay. Any questions on that? All right. Since we're here, guys, let's go over So I guess everything is checked out. The suction machine, concentrator. Okay, none would be there. I was okay. Another important thing: when somebody's diabetic, and then they become unconscious because the blood sugar has gone down, we have a glucagon that's powder. Okay, it's in our e-kit. Does anybody know what part of e-kit this is available? Where can you get this? It's important.
The gray one?
Huh?
The gray kit?
Which grade e-kit?
The metal one? Cabinet?
Yes, the IM. Right? It's the IM e-kit that has this powder glucagon. Okay, it's not in the Pyxis and it's not in the IV. So it's gonna be in your, is it IM or is it oral? No, it's IM, right? Yeah, it's IM, I'm right, yeah. It's the IM, and there's an order already pre-made for you in Matrix. Okay, it's under diabetic order. Okay, I have this computer right here. So what you need to do is basically, call a doctor. They should already have their diabetic.
It's okay.
Right? And they're sweaty, they're not verbal, maybe they're not responding. And so this is kind of what it looks like. Okay? And it's intranasal, basically.
Yeah.
You use it one time, and then, sorry, I'm going the wrong way here. And then you squirt it in the nasal passageway, right? And then if you need to give a second one because it's not working, you need to call a doctor and get another order, okay? But you can put this in as an order by just going under the matrix and going to standing orders. It's called Baqsimi, and it's a powdered glucagon, okay? So create an order, call a doctor. If you don't have an order yet, know that this is in the IM box and you can give it intranasal. Okay? Anybody has questions on this?
Is it a one dose use only?
It's one dose only.
Yeah, and
It's
if
one
you
use.
have to administer another one, you have to call the doctor.
Oh, okay.
Yeah,
So we only have one for the weekend.
that's right. Here's the thing with our pharmacy, if you run out, you can do an emergency delivery, a stat delivery, and they can deliver it right away. Okay, so is that gonna help you at the moment you need a second one? No.
No.
Okay, so, but hopefully kind of wakes that patient up a little bit and give them some orange juice, a little bit of sugar. And at that point, you're probably gonna call 911 anyway, if you can't get them to get up, right? You're gonna give this one time call 911, call the doctor, okay? There's another one that we give. It's for narcotics. What do you find that? And what is that called?
Narcan.
Narcan, right? And that is also a standing order that you can give PRN for somebody who might overdose on narcotics. Okay? All right. Any questions on that? Okay. So the last, the other equipment that we kind of deal with when somebody comes in and they want to ask you how to clean is the glucometer. So the glucometer, just make sure, according to Samuel's RP, you need to clean that with bleach, okay? Especially if you're dealing with a diabetic patient that's in a isolated room. So make sure you're using bleach to kind of clean that off, okay? You move on to the next person. The same thing, guys, with blood pressure machine. This one's easy. You know, they're not really trying to, micro manage you when you're passing your meds. Just know that the only time you use bleach is when you're cleaning those equipment or when you're dealing with CEDA,
Feed it, yeah.
right? Everything else you can use this right here. Okay. Anyone that's like isolated, and you need to clean your BP machine, you can use the whatever's available. Unless they're C. diff, then you do bleach. Okay.
The wipes, the
The
stereo
wipes right here, yeah, right here. So, just remember this thing too, I think we talked about this, a lot of our nurses notice that this has kill time. This has kill time, any surface that you're washing or cleaning, it's gotta be moist for whatever time frame that it's noted on here. It could be 60 seconds, could be 120 seconds, but if Surveyor asks you about kill time, that means that if you're trying to wipe a surface down, it has to be moist and wet for that amount of time. You're taking a cloth and you're drying it off, you're not killing the bacteria or pathogen that's on there. Okay, the last thing is, everybody here is pretty comfortable using this, which is our bladder scanner, okay? Most important thing is, this is like, a fifth grader can use this, right? Most important thing is that the battery's right here. If you're running out of battery, it's inside the med room, you can replace it, turn him on. And one thing is gonna ask you which side of the bed are you in, okay? And you're either on the left side of the bed, on the right side of the bed, and then all you're really doing is using this gel right here, applying it. I don't have a good picture, so I stole this from YouTube. But make sure that so here's the area right here where you should scan it, and you're looking down, so it's kind of like you're looking down at the bladder like that, and you're trying to get a number on how much is on there, right? So this right here, and you just push the button one time, and then basically this bladder, you're kind of looking down like this. Okay, it's kind of like you're a little bit higher and looking down and picking up on the amount of fluid that's in the bladder. Okay, so simple to use. We just want to make sure all of our nurses are aware of that. And then you can, I don't know, does anybody know if it still prints pretty good?
It doesn't.
The printer, it doesn't. Okay, so you're basically noting it, how many ml in terms of urine that's on there. Okay, so important, guys. Just make sure you're putting left or right side of the bed there. Okay, because that might impact the scanning and the reading. Okay. Anything is on there in terms of, that's it. Any questions? Proper cleaning, bladder scanner, and disinfecting.
John, the batteries for that is underneath the unit clerk's desk.
Oh, they move it to the unit clerk's desk. Okay.
In the med room.
All right. Does anybody want to add anything in terms of responding to an emergency, MU bag. Okay, I'll go ahead and sign your paper for all of our nurses.